After screening, the next step you can take to decrease older adults' risk of falling is to review and manage their medications.
The STEADI project highlights medication review as an important component of falls risk evaluation and management.
All older adult patients periodically should have the medications they take carefully reviewed, including prescription drugs, over-the-counter or OTC drugs, vitamins, and herbal supplements. The goal of medication management is to stop, switch, or reduce any medications that may have side effects or interactions that can increase a patient's chances of falling. Also consider how some medications might have undesired or heightened effects in patients with certain diseases or conditions. Consult the updated Beers list for reference.
Clinicians can review medications, and this might be one of the most important things clinicians can do because many older adults are on medications that increase the risk of falls. So clinicians can review medication lists, see which drugs might increase the risk of falls in older adults, and try to reduce those drugs in their patients. They can also look at drug-drug interactions and things like that to ensure that they're not giving their patients medications that might enhance their risk of falls.
If your office uses appointment reminders, include a brief statement about bringing their medications and OTC products, whether used regularly or occasionally. This type of brown bag review for medication management is more accurate because medication lists based on patient recall or generated from health records are often incomplete, out of date, or may lack OTC product. Staff can assist by reconciling what the patient actually takes with what is listed in the health record. This will create an inclusive and accurate list for the provider to complete the medication review.
We often employ our nurse care managers. We have patients bring in what we call their brown bag of medication. So they will bring in all of their medications, including any over-the-counter medications, or even medications that we might not consider to be medications, but are supplements of one form or another. And then that entire medication list is then available to the provider to evaluate comprehensively and understand what, if any, medications might be putting that person at risk for falls, cognitive impairment, urinary issues, etc.
The medications most strongly linked to falls are the psychoactive medications that act on the central nervous system. These include anticonvulsants, TCA and SSRI antidepressants, antipsychotics, benzodiazepines, opioids, and the sedative hypnotics isoprolol, zaloplan, and zolpidem. In addition to these high-risk medications, identify any duplicate prescriptions, potential interactions, or OTC medications that put your patients at risk.
Medications that affect the CNS or the psychoactives can increase fall risk in older adults. These include medications like benzodiazepines, antidepressants, or sedative hypnotics. Also consider medications that have anticholinergic effects, which means that they can cause confusion, sedation, orthostatic hypotension, or blurry vision. And these are commonly found in over-the-counter antihistamines that are used to treat common conditions like cold, cough, allergies, or even help with sleep. While we know medications are effective in treating health conditions, they do have side effects and interactions that can increase the risk of falls in older adults. So that's why when we're trying to limit the use of medications, we try to add non-pharmacologic options when treating common conditions like insomnia, pain, or anxiety.
With these higher-risk medications in mind, consider whether you can stop, switch, or reduce any of them. Stop medications when possible. Switch to a safer alternative. Reduce all medications to their lowest effective dose. Starting doses in older adults are typically half of the standard adult dose. Consider whether current medications might still work with lower doses. Conduct a trial of dose reduction. Dosing guidance for people 65 and older is available. Refer to the electronic prescribing resources your institution may have access to, and be sure to look up geriatric-specific dosing.
A thorough medication review can be done in a few simple steps. It starts with your patient bringing in their medications from home. Ask them to bring in their prescription drugs, their over-the-counter drugs, and supplements, and screen those medications for anything that may increase fall risk. Next, assess your patient. See how they're doing on their medications. Do they have any side effects? Are they adherent to their medications? And do they have any concerns with those medications? Next, formulate a plan. Find out what medications you are able to either stop, switch, or reduce. And finally, sit down with your patient and caregiver and educate them on medication changes. Make sure they understand why these changes are happening and what other strategies they can do to prevent falls in the future.
Medication review is critically important as older adults age because the ability to metabolize and clear medications decreases substantially over time.
It's really important for providers to recognize that they have tools at their disposal to tailor medications based on a patient's kidney function. Providers need to recognize that by the time a person reaches the age of 80, their kidney has decreased in its functional ability by about 50%, even absent any disease. This often translates into drugs either needing to be discontinued or to have the dose dramatically tapered. We know in geriatrics that stopping a medication is much more difficult than starting a medication, and yet very important all the same as a person ages.
Because conversations about changing medications can be difficult, STEADI provides resources and case studies on talking to your patients about necessary medication changes. Reviewing medications is also important if the patient has symptoms of postural hypotension, which is a risk factor for falls and affects more than 1 in 4 older adults. For example, if a patient is taking medication for hypertension and develops postural hypotension, the dosage of their hypertension medications may need to be adjusted. STEADI provides a standardized method for measuring postural blood pressure. This can be found at cdc.gov/STEADI. In addition, the STEADI brochure, Postural Hypotension, What It Is and How to Manage It, can help you explain the condition to your patient and highlight appropriate recommendations. In medication review and management, a pharmacist can be a valuable resource. They can help create a plan for medication management. They can also assist with adjusting medications based on age, weight, gender, and health conditions. Finally, a pharmacist's medication therapy management review may be covered by Medicare.
Medication review and management can be complex because we are looking at more than just the medication list. We do this because we want our patients to be on the best and safest therapy. Pharmacists are specifically trained in medication therapy management, and we do this on a daily basis. Consider partnering with us so we can help you and your team.
It is extremely important for your patient to understand their medications and why you may make changes. Describe how age can affect the way medications work and explain how medications can affect their fall risk so they understand any adjustments. To assist you in effective medication review and management, CDC has developed a framework called the SAFE approach to help you screen medications, assess adherence and side effects, formulate a plan, and educate your patient about the changes. This approach can help you develop a routine for thorough medication review and management and is available at the STEADI website, cdc.gov/STEADI. Here you will also find guidance on how to talk to your patients who are reluctant to change their medication. Taking the time to review medications is time well spent with your patients.
I had an elderly gentleman who I didn't know he was at increased risk of falls, and he didn't know he was at increased risk of falls, but he scored high on his STEADI falls risk assessment. So we looked at his medications and were able to stop a couple that were increasing his risk of falls. In addition, he told me that he had been afraid of falling, and I was able to have him do a PT gait and balance evaluation to learn an exercise program that would make him have less fear of falling. Both of these things allowed him to get back out into the community and do more of the things that he loved to do.
For a medication review to be most effective, it's important to use appointment reminders to encourage patients to bring everything they take regularly or occasionally to their appointment. Review all medications, over-the-counter drugs, vitamins, and herbal supplements. Stop medications when possible. Switch a needed higher risk medication for one of lower risk. Reduce all medications to the lowest effective dose. Enlist the help of a pharmacist if you have questions.